Good afternoon, everyone. My name is Jackie Leiser. I'm a manager with the CAQH core team, and we're really excited to have you all join us for today's webinar where we're joined by NACHA and InstaMed, a JP Morgan company, to talk about trends in healthcare payments. Before we jump into the agenda, I do want to go over some brief logistics with you all. If you'd like to access today's materials, you can do so by downloading the presentation slides from the handout section of the GoToWebinar menu. We'll also send out an email to all attendees and registrants in the next 1 to 2 business days with information on how to access those slides and today's recording. If you have a question, please feel free to do so at any time throughout the presentation using that questions panel on your GoToWebinar menu. We'll have a few minutes at the end to take a look at those and do a Q&A with our speakers. Looking at the next slide, I'm going to go over our agenda briefly before I let our speakers introduce themselves. So we will have a brief introduction on electronic healthcare payments. Then we'll hear from NACHA about driving healthcare EFT payments via ACH. CAQH Core will then discuss automation of payment and remittance transactions. And then last but not least, JP Morgan Healthcare Payments will talk about the costs of being a consumer of healthcare. We'll wrap things up then with a call to action and questions from the audience. And with that, I'll go ahead and turn things over to our speakers for today.
Good morning, good afternoon. My name is Deirdre Ruddle. I am part of the JP Morgan Healthcare Payments team, which includes our InstaMed product. And for the past 13 years, we have put together a trends report focusing on what's happening in the healthcare payments ecosystem from the perspective of consumers, providers, and payers or health plans. So looking forward to the discussion today as we look at both things from the transaction point of view as well as from the stakeholder point of view.
I'm Brad Smith from NACHA, and NACHA was integral in working with CAQH in creating the payment section of the core operating rules back in 2012 or so. My responsibility at NACHA is to work with different industries that are underutilizing ACH as a payment type. And healthcare was one of the very first verticals or industries that we worked with. I also do work in the nonprofit space, subscriptions, colleges and universities, religious organizations, et cetera.
Great. And I'm Erin Weber. I'm the Vice President of CAQH Core and lead all of our rule development and education and outreach efforts across the initiative. And just want to thank Deirdre and Brad for joining us today. I should also note that InstaMed is a member of the CAQH Core board. And as Brad mentioned, we have worked collaboratively with NACHA for more than 10 years now on operating rules for the EFT transactions and the ERA transactions. So thanks so much for joining us today. On the next slide, I think Brad, I'm going to kick us off with a little bit of introduction and background on healthcare payments and where we're going to focus our time today. So if we go to the next slide, there are requirements in HIPAA for HIPAA covered entities to use standard transactions to exchange data. And there are several transactions that are named, and electronic funds transfer and electronic remittance advice are 2 of those. And we're really here talking about payments from a health plan to a provider. Any HIPAA covered health plan is required to offer both the EFT and ERA standard to any provider that would like to receive them. And those payments flow over the ACH network, which NACHA governs, and I'm sure Brad will talk more about in a minute, which is able to drive payments across all of the banks and credit unions across the country. On the next slide, you can see a visual overview of the payment flow that we are going to be talking about today. I think one of the key things to think about is the ERA is really the receipt. It tells you what the payment was made for, where the EFT is the payment itself. And they flow separately from the health plan to the provider organization. So the provider has to reconcile or reassociate those two transactions once they are received. And so some of the challenges industry has had over the years is trying to figure out how to do that in an automated way, which both the standards and the operating rules help with greatly. And then there's another whole component of payments that providers contend with, and that's patient payments for co-pays, co-insurance, deductibles, and making sure that that is a seamless encounter. I think we have all been to our physician offices and ideally been asked to provide co-payment for services at the time of service. But that's not always the case, and there's lots of ways in which providers do that patient collections piece. And Deirdre's going to talk about what's happening in the industry from that perspective today. So a little bit of both sides, health plan payments and patient payments, with the provider kind of being the recipient of all of that. I'm now going to turn it over to Brad to kick us off and give us a little bit of an update and background on where we are in terms of EFT payments across the industry. Brad?
Great, thank you. I'm going to ask a question, and I don't really expect you to answer. We don't have a way for that right now, but if you had to guess which non-cash payment, so don't think about cash because cash is still king, which type of non-cash payment was moved the most money through the US economy in 2021? If your first thought was ACH credit, then you're correct. You can change that slide for me if you don't mind. If you look at this chart, you can see trends in non-cash payments by value, and the two dotted orange lines, or the two orange lines, are both ACH. ACH credits responsible for almost $60 trillion in 2021, and then the debits were responsible for like 22 trillion or $32 trillion. So we're talking almost $100 trillion of ACH payments that went through the US economy in 2021. This report comes from the Federal Reserve. They do a triennial payment study. I know you've all read it. No, I'm sure you haven't. But this demonstrates the power of ACH, the value of ACH transactions. So if you're wondering what ACH is, this is your direct deposit of payroll. This is your online bill pay. This is your IRS tax refund or your IRS tax payment. These are business to business payments. And when we talk about B2B or business to business payments, we're talking about healthcare payments, like from the payer to the provider, are technically business to business payments. Now, just one side note here, I don't want to talk about checks a lot, but it's remarkable to me that checks still was third place in moving money through the US economy. We anticipated the death of checks by 2020, and obviously that has not happened, or not even close to happening. Anyway, next slide, please. So in that Federal Reserve triennial study, they indicated that the increase in the value of ACH transfers accounted for more than 90% of the rise in non-cash payments value from 2018 to 2021. So in regard to this, on that previous slide, you saw the bottom three lines were all card payments: credit card, debit card, and prepaid debit. Those are high volume transactions. You make many of those, possibly a day, but the dollar amounts they move don't come anywhere close to what ACH payments are. So what I'm getting at is you can depend on the ACH network for moving money from one entity to another, to getting paid by the plans, to getting paid by the payers, for the money that you get from the claim that you made with them. This is a secure, reliable system. You may be reading or hearing that ACH is a legacy, antiquated payment system, and that's just not true. There has been so much innovation in the network in the last 10 years that it's pretty incredible. You can get paid in a day, you could get paid in 2 days, you can get paid same day by ACH. And the cost associated with ACH transfers is much less than you would be, especially from a virtual credit card, and much less than checks if you take into consideration all of the soft costs associated with checks, with printing and depositing and finding lost checks and things like that. So there's much more to checks than just what we see. Next slide, please. Now, in 2022, now just a side note, that the numbers here that I show is only payments that go through the ACH network and dollars that actually flow through the ACH network. The slide I showed you from the Fed study includes what they call on-us payments, and some of you might know what that is, but on-us payments would be if I had a checking account at Bank of America and Nacha also used Bank of America as their bank, and they sent direct deposit, that money will go directly from Bank of America into like my checking account. It would not go out into the ACH network and then come back into my account. So those are on us transactions. And obviously there's a lot of those going on. So this number is still impressive. $76.7 trillion went through the ACH network in 2022. And there are 30 billion individual ACH transactions that went through the network. Next slide, please. Now, looking specifically at healthcare EFT volume, and again, we worked with CAQH way back in like 2012 or so to really help them develop the payment section of the core operating rules. And you can see from the growth here that we've seen pretty steady growth each year in healthcare EFTs. We had a slight bump in 2020 for obvious reasons, but we've recovered very well. So the volume grew in 2022 by 6.1%. And I know that we can do better. When you look at the CAQH index, just real briefly, the healthcare industry is about 71-ish% claim payments being made by ACH. So there's a lot of room for improvement there. And on the dental side, we have some work to do because that's probably closer to 18 to 19% of all claim payments are made by EFT. So if you are a provider and are looking to get paid safely, securely, quickly, you should be asking to get paid by ACH for your EFT. And we are quite understanding of the issues with reconciliation or reassociation with the ACH transactions, and we are working with the industry to see what we can do about that and make that more simple for you to reassociate or reconcile those claim payments. So I'm going to turn this back over to Erin at this time.
Thanks, Brad. Looking at this slide, it's just so fascinating to see the impact of named standards and operating rules on the volume of EFT from 2013 to 2014. I mean, that's when CMS named the EFT standard as well as the operating rules, and you can just see a huge jump in consistency in how organizations were getting paid. So that's
absolutely
cool data. I'm not sure I've ever noticed that the jump was that significant at that time.
Pretty big. 450 million last year.
Yeah, wow. I'm going to give a quick overview on the next couple slides of CORE. I'm guessing most of you on the line have heard of us and know about the work that we do, but if we could go to the next slide. CORE was developed and really we were modeled after NACHA in the financial services industry to develop operating rules to help drive the adoption and use of healthcare standards in our own industry. So we have a number of participating organizations that participate in our subgroups and work groups all of our work is industry driven and led by industry co-chairs. Our role is really just to facilitate the development of the operating rules. We measure ROI, we have a certification program, and we do a lot of industry education and outreach as well to make sure that industry is aware of the resources and benefits of operating rules and standards. Next slide. Not much more to add here, except that back in 2010, CORE was designated as the national operating rule authoring entity for all of the HIPAA mandated transactions. And so several of our operating rules, including those for EFT and ERA, are federally mandated for all HIPAA covered entities. Quick glance on slide 16. If you're wondering who is at the table for all of this work, these are our participating organizations, and you can see it really spans the gamut in terms of stakeholder types. We have all of the implementers at the table, as well as many advisory bodies and associations that represent some of these stakeholders as well. So if you're not yet a participant, I hope you hear some of the information today, and it encourages you to have a seat at the table and really help drive automation across our industry. Next slide. Screen went funny. So on the next slide, I just want to highlight the existing CAQH core EFT and ERA operating rules. So the first, there you got a little visitor today. The first set of operating rules includes requirements for both infrastructure and data content related to both the EFT and ERA standard. So we have the infrastructure rule for the 835, which is the standard for ERA. Some really great news, just late breaking as of yesterday, is that the National Committee on Vital and Health Statistics, which is a federal advisory body to HHS on issues related to administrative simplification, privacy and security, population health, they met yesterday and made a recommendation to the Secretary of HHS to adopt an updated version of the ERA infrastructure rule. The main update in that infrastructure rule is an updated connectivity version that organizations would be required to use. So this recommendation will go to HHS, and then CMS will begin a rulemaking process where there'll be a regulation put out with a public comment period, and there are a number of other rule updates outside of the scope of the EFT and ERA operating rules that were recommended as well as one new operating rule. So we'll be sharing more on that in the coming days. There is a rule to support reassociation of EFT and ERA. I mentioned that that was a pain point. So the core stakeholders really worked to identify what are the data elements that are needed to map these two transactions back to each other in an automated fashion. We have a uniform use of CARCs and MERCs operating rule, and those are the denial and remittance codes that are included on the 835. So a provider understands why a claim may have been denied or adjusted. This rule puts those codes into code combinations and business scenarios so that there is more consistency in how health plans are using those codes, allowing providers to automate their systems. And then finally, we have the EFT and ERA enrollment data rules. These two rules include a set of data elements that must be collected when a health plan is enrolling a provider in EFT or ERA. Some new news around these rules is that we will be updating these rules later this year. So I expect a call for participants to go out to participate in this process to our core participating organizations over the next couple weeks. We decided that it was time to update these rules, the core participants and the core board, largely because there have been a lot of security challenges over the last few years with this information, and a lot of evolution has happened in the past 10 years since the rules were first developed. Additionally, I think CMS really feels that there is an opportunity to update these rules to help drive more adoption of EFT and ERA across the industry. So I'm going to share some data now on the next couple slides. This data comes from the CAQH Index report, which tracks industry adoption of electronic transactions, including EFT and ERA, or claim payment, as we have so called it on this slide. I first want to note the progress, and it's kind of similar to the data that Brad shared, but we have been collecting index data now for 10 years. And in 2012, we were only collecting for the medical industry, not the dental industry. But the percent of claim payments that were conducted electronically in 2012 was 50%. So half of healthcare payments were conducted electronically. You can see we've made a lot of progress over the past 10 years. Brad's slide shows that as well. But this is really the only transaction where adoption slightly decreased for the medical industry in this year's CAQH Index report. But there was a substantial increase in prior years. The index also tracks volume, and we found that the volume for the medical industry of EFT decreased this year, but after increasing substantially last year as providers reconciled late payments due to low utilization. So the number of payments was a little bit inflated last year given this behavior, and now is starting to return to pre-pandemic levels. Interestingly, after decreasing last year, the dental industry is experiencing an increase in claim payment volume due to higher utilization. So the volume increase there was driven by greater use of EFTs, which has been an ongoing focus for that industry. And then on the next slide, we'll look a little bit deeper at the remittance advice adoption. And you can see some significant gains here, particularly for the medical industry. The medical industry had a 19% increase over the past year, and dental 11 percentage points. This increase was the largest across all transactions for the medical industry and the second largest for the dental industry in this year's index report. That growth contributed to a 40 percentage point increase in electronic adoption for the medical industry over the past 10 years, and a 23 percentage point increase for the dental industry over the past 6 years. So a lot of progress happening with these transactions. With the increase in dental adoption, we think may be due to continued promotion of both EFT and ERA, in particular by the American Dental Association. That's been a real focus of them over the past few years. From a volume perspective, we saw the medical volume actually decrease as the practice of posting duplicate remittance advices on both the health plan's portal and through the electronic remittance advice seems to be declining. That's why you see that big drop in the use of portals. It was a 55% drop over the last year. So we were seeing a lot of dual posting before, and now it's really moving to the electronic transaction. Kind of the opposite seems to be happening in the dental industry, which appears to be posting more duplicate remittances in the portals, as well as increasing the use of the ERA. Duplicate posting does offer dental providers various opportunities to access that payment information, and sometimes is preferred. So next slide just talks about some of the benefits of adoption of both the standard and the operating rules here, EFT and ERA. Really eliminates a lot of manual work, improves cash flow. If you're getting paid via EFT, you're not having to go deposit checks. It increases the ability to conduct targeted payment and follow-up, standardizes enrollments, and automates that reassociation process. So all benefits of these operating rules. I want to move into some of the details around the index data related to cost savings opportunities. So on the next slide, despite the decrease in volume for the EFT, medical providers did spend more time processing manual transactions, and that increases the cost of the transaction overall. Similarly, dental spending increased as the time and cost to conduct manual payments rose for dental providers. Part of this, as social distancing policies and requirements loosened over the past year, providers and staff resumed going to the bank to deposit checks. And for both medical and dental, this increase in cost savings potential was due to the increase in cost and time associated with providers using paper checks. So while EFT increased for the dental industry, the cost to conduct a manual transaction countered any savings, if that makes sense. And then you can see here, there's time savings by staff, dealing with an EFT transaction, an electronic transaction versus a manual transaction. Similar information for the remittance advice on the next slide. We really saw the increase in provider costs impact the growth in medical spend on remittance advice. So medical providers and staff, were many of which, because of the Great Resignation and the pandemic, were newly hired and inexperienced. And so it took them more time to access information and conduct these transactions, which increased the cost of the transactions. The cost associated with remittance advice also increased for the dental industry and accounted for 24% of the total annual dental spend, which is the highest spend along with the eligibility and benefits verifications. Higher volume and cost for dental providers contributed to higher spend in that industry. But you can see here, there are significant time savings, again, by moving from a manual process to a fully automated process, 7 full minutes in the medical industry for using the remittance advice transaction. And I would be remiss on the next slide, giving a presentation on electronic payments without addressing sort of the elephant in the room that we always get questions about, and we did in the pre-submitted questions for this webinar, around the use of virtual cards or other forms of electronic payment which are permitted under HIPAA. So just to clarify, the EFT and ERA standards under HIPAA do permit health plans to pay claims via paper check, Fedwire, or virtual cards, but if a provider requests payment via the mandated standards, the health plan must comply. And so that's really important for providers to know. And just last year, CMS published some additional guidance and new FAQs related to some of the questions they were getting from providers. And this has been something ongoing in the industry for many years. I want to also highlight the CMS National Standards Group administers a compliance review program to ensure compliance among covered entities with the HIPAA administrative simplification requirements, including the EFT and ERA standards and operating rules. So if a provider is not able to get electronic EFT or ERA from a health plan, they should work with this group through their asset tool, which we've linked here, to work towards a resolution. I also just want to highlight that this is a topic that came up in the National Committee on Vital and Health Statistics meeting that occurred yesterday as well. They had reviewed a potential update to the 835 standard and heard from quite a few providers around the challenges with virtual cards as part of their comment period. And so the committee is including recommendations in a letter to the secretary to encourage HHS to develop and publish additional virtual card guidance and education. They felt like more needed to be done so covered entities and their business associates really clearly understand the permitted and non-permitted uses of virtual cards when used in lieu of the EFT. And they really are going to encourage HHS in those recommendations to increase enforcement efforts when it gets complaints of inappropriate use of virtual credit cards. So with that, I'm going to turn it over to Deirdre to talk about healthcare payments from a consumer perspective, one we can probably all relate to.
Thanks, Erin. So we've heard from Erin and Brad on the transaction side of things, and now what we're going to do is talk about it from the perspective of the stakeholders, consumers in the healthcare space, which I believe most of the people on the phone or watching this webinar are, as well as provider organizations and then health plans. And just some quick context for the trends report that we put together each year. What we do is we look at data from the InstaMed platform, which represents billions of dollars of transactions processed across all healthcare transactions, both B2B payments as well as C2B payments. And then we also survey consumers, providers, and health plans and get a better sense of the sentiments that they have regarding the industry. So if we go to the next slide, in recent years, there are many emerging trends that have been amplified by the increasing costs of healthcare for consumers. The most alarming is medical debt. 1 in 10 consumers owe at least $250 in medical debt. In fact, large healthcare expenses can impact families' finances for a year or even more. And so one of the unfortunate realities of this is that it is stopping patients or delaying patients from accessing care. 38% of consumers delaying care or treatment because they're concerned with the cost. And 27% of those consumers are putting off medical treatment and they're likely serious conditions. So we can see how the stress and the often frustration around the consumer healthcare payments experience starts with some pretty impactful statistics. So if we go to the next slide. So lack of price transparency. This is certainly is something that's been talked about in the industry for several years now, and it's not uncommon that consumers won't know how much they'll owe before a provider visit. And with new tools that have come up with, as a result often of the No Surprises Act, there's not the adoption that they're hoped to be initially with this. So 59% of consumers haven't used online pricing information or online tools or said that it wasn't available. So that's not helping them get a better sense of what it is. And almost the majority of consumers don't know how much things will cost. Meanwhile, almost 9 out of 10 consumers want to understand and say that that's an important part of understanding, what's going to happen at a provider visit. And that's certainly true these days. We look at the economic factors that are happening, and then we think about experiences that we have in other industries, whether it's buying a car or even a piece of furniture. The cost that you will incur and have a good sense of how to fit that into your budget. Unfortunately, there's so much of that lacking in the healthcare payments experience for consumers. And so if we go to the next slide, we can see that of course frustrates consumers. And so people are not understanding what the costs are going to be, and while the costs have increased considerably. Unfortunately, with those two factors happening, we haven't seen the payment experience radically change, and that frustrates consumers. Most consumers, 71%, report that they are confused by medical bills. Even more, at 76% of consumers, state that they've received at least one unexpected medical bill. And you think, okay, almost 3 out of 4 consumers are both confused or receiving bills that they don't expect. How does that happen? And then you can see one of the root causes is very likely the fact that 68% of consumers receive that statement for that encounter over a month after the service happens. You can see the disconnect between, that experience and that encounter versus the time of billing. So if we go to the next slide, what are the impacts of these negative consumer experiences? There is a real connection between the payment experience and the overall consumer healthcare experience, and they're correlated. That negative payment experience can bring negativity to the entire healthcare experience, including the clinical side of things. And so the statistics on this slide show how a broken payment experience can impact patients and then ultimately can affect attrition. There's a strong correlation between the 35% of consumers having no option to pay their medical bills online and then the 42% of consumers who would consider switching care solely based on the payment experience. And so the reality is that most consumers are not happy about healthcare and its cost. And unfortunately, the outdated payment experiences are only adding to this friction when consumers are trying to pay their medical bills. 30% of consumers ended more than one transaction because they couldn't pay with a credit card or a debit card. A 30% increase in patient transactions would have a tremendous impact on any organization, and with a simple everyday offering that patients are used to. This is what they've come to expect. And so if we look at the next slide, so what happens if we think about that consumer experience? What happens when we change things? And really, the key to solving these trends is convenience, which I'm sure that most of us on this call can relate to. Convenience for patients and convenience for staff. As consumers, we all continuously value convenience in every aspect of our lives. We make dinner reservations, we have groceries delivered to our doorstep. And we want the same thing in healthcare. We want these when we're selecting a healthcare provider. 92% of patients say convenience is an important factor when choosing a primary care provider. Convenience is prioritized in almost all payment spaces, as most, or really, as you can see here, 91% of consumers pay recurring household bills online. And you can certainly, think about the data that you saw from Brad and the Fed and NACHA. Electronic payments are, of course, growing significantly, and they're being experienced in most other aspects of consumers' lives. And so if we go to the next slide, this convenience is expected because of the things that I just touched on. And we know digital options, they're not new, but it was really within the pandemic that we experienced this slingshot into the adoption of it. We were all, at home in the beginning of the pandemic, and what did we turn to? We turned to the internet, we turned to the phones that were probably close by us almost 24 hours a day. And we use those to connect to each other, our families, to do shopping, and often we were utilizing things like stored payment methods on platforms for future use. Through the pandemic, businesses and providers needed to give more convenience in new virtual and self-service channels than they had ever done before. And here we are, 3 years later. Most consumers now expect that this newfound convenience is here to stay. 77% of consumers now expect virtual and self-service options to be offered. 67% of want digital and electronic payment options like e-statements or being able to pay online. And in fact, the majority, almost 9 out of 10 consumers, want to pay all their medical bills in one place. Interestingly enough, it's not all the same place. Consumers have different preferences of the one place they want to make all those payments, which is why so many payment options is important as we think about the consumer experience. But the bottom line is that convenience is such a driver in consumer expectations, regardless of generation. And so if we go to the next slide. So now we're going to talk about the provider perspective, and I'll caveat this before I start to talk about the administrative side of things and the financial side of things for providers. Certainly healthcare organizations were impacted so significantly by the pandemic, and the intensity of what they had to face in light of a global pandemic is something that I don't think any of us have even fully processed yet. And so I just want to acknowledge that before we start to talk about, the administrative impacts, the financial impacts of the pandemic. And now providers are certainly facing a storm of challenges, rampant inflation, rising interest rates, a loss in interest or investment income, an epic shift in staffing models. they've all wrapped up in the need to rebalance and align healthcare at a national level post global pandemic. And there's certainly no shortage of headwinds facing providers, and certainly this is a time where we'll need to be figuring out what does the new normal look like. And so if we look at the stats on this slide, we can see the financial impacts of the pandemic. You see that over half of hospitals were projected to have negative margins in 2022. And then you can see that there's external funding needs that were required to stay open. And then, I think that last stat on the slide, the total supply chain cost to serve for health system averages, 37% of the total cost of patient care. These figures really shine light on what provider organizations are facing today. So if we go to the next slide, we've all heard about the Great Resignation, as well as what's happened within the healthcare industry from a burnout perspective, and both on the clinical side of things as well as the administrative side of things. And all these stats on this slide show how challenging the staffing environment has been for healthcare organizations. And there's been the surge of the gig economy with traveling nurses along with other things. And then there was the Great Resignation. And so you look at all these stats and you see that there's challenges to attract, train, and retain staff for vital positions, again, both on the clinical and administrative side of things. And meanwhile, those labor costs have grown significantly in a very rapid time period. And so you can see how challenging that is. And similar to Erin's point earlier, the other thing that we really need to think about is the cost of new staff and the cost of building or rebuilding. And when you think about it, rebuilding institutional knowledge and culture is not something that can be done in a few hours of on-the-job training. To fully address this issue, we need to figure out how to both retain staff as well as deploy common operating platforms to allow for cross-job mobility and sharing, because staffing is so impactful. And we'll see in the next slide that there's even bigger impacts with this. So when we look at patient volume and collections, that certainly impacts providers' finances. And so when you have staffing challenges and shortages, you can't see as many patients. And so you can see that close to 30% of providers had to reduce the number of patient visits available due to staff shortages, as well as organizations just can't have the same number of hours, again, because there's so much in that staffing piece of it. And, it's not just the clinician piece of it. There are patient access staff, revenue cycle staff, finance staff, and you start to think about that in practical terms. It's hard to see a patient when no one is available to work scheduling. It's hard to complete a surgery if there's no one to work registration. It's hard to run a business office, based on all those factors and all those, really big challenges that provider organizations are facing. And so that certainly ties into why electronic payments, self-service patient experiences, more automation, both for consumers and for staff, could certainly help with some of these big challenges that providers are facing. And so if we go to the next slide, so 78% of providers primarily collect from patients using paper and manual processes. So let's think about that in context of what we just talked about around, the limited number of people who are able to perform those manual processes or, manage that paper. And so while the pandemic helped increase the rise of e-commerce and digital experiences in almost every industry, healthcare is still lagging behind. It doesn't mean that we didn't make progress and we didn't see an increase in digital experiences during the pandemic, but what it is showing us is that we still have so much ground to cover. 55% of providers primarily collect from patients with mailed statements. Brad referenced checks earlier in this presentation. I think most of us would say that paper bills and checks are certainly not our preferred payment method. And that, again, is something that goes across generations. Even those who want to have some type of paper artifact are comfortable receiving it digitally. They're comfortable receiving it through an e-statement or another means. No one wants the paper, no one wants the checks, and yet it's still so prevalent in healthcare. And so 23% of providers primarily collect from patients with in-person and staff outreach. You think about that and the staff shortages and what's happening there, you can see a really big disconnect. And so these staff-intensive approaches to payments and billing, they're not effective. And so it's no wonder that these methods are not delivering great results. You can see that almost 3 out of 4 provider organizations say that it takes 2 or more statements to collect a patient balance in full. And 37% of providers say it takes 3 statements. And so you certainly can extract or extrapolate the impact that this delay in receiving funds or never receiving funds has on provider organizations. So if we look at the next slide, I know that many of the things that I'm sharing may seem a little doom and gloom, but these are some of the statistics and provider sentiments that I think show hope within the industry and show how all stakeholders are getting a better sense of just how important this is. And so if we look at the fact that 3 out of 4 providers say that billing and collections, will impact the overall patient experience, and that close to 40% of providers are prioritizing those self-service options, you can really see there is going to be a shift. There has to be a shift. As we look at the millennials as the largest generation in the workforce, with Gen Z right behind them, they are all digital natives, and they are expecting these digital experiences that are not based in paper checks and mail. That's what they're expecting from every industry, not just the retail industries. And so finally, if we go to the next slide, we'll talk about, the perspective of the payer or the health plan. And so, during the pandemic, there was certainly a decrease in patient volume, one, because of course there was so much focus just on treating those with COVID-19. And then there are, varying degrees of lockdown and, people's willingness to go into public places, including the doctor. So what does that mean for health plans? If we go to the next slide. Payers are absolutely facing operational challenges at the same time. Payers are experiencing different challenges than provider organizations, but you can see that there's, absolutely impacts on the health plan ecosystem. There's no precedent to predict how and when patient volumes will return to pre-pandemic levels. In fact, there are more questions than data. Will patients return sicker due to missed screenings and increases in unhealthy behavior? Whatever the answer to these questions, payer organizations, based on the data, do not seem adequately prepared to handle major upticks, considering the operational challenges reported in 2022. Over half of payers faced staffing challenges in attrition and then not being able to fill open positions. And that, of course, directly impacts the day-to-day operations, along with the member and provider experiences. So if we go to the next slide. And so we can see that these, challenges stall, growth for payers as well as, their approach. And so any potential disruption to the status quo will likely compound existing challenges for payers, especially the friction in the provider and member experiences with payers. Payers already say that phone calls due to confusion and payment questions from both providers and members are a top challenge. And we've already seen the stats from both consumers and providers on why this is happening. Call volume is the direct result of existing tools and channels not meeting the needs of providers and members, and likely an indicator of a poor experience with that payer's brand, which the payers are absolutely concerned about. And so then if we go to the next slide, another aspect of this, of course, is the importance of the member experience. Consumers, from a provider perspective, their patients, from a health plan's perspective, their members, but ultimately we're talking about the same consumers who are all looking for these better digital experiences. And so the importance of that can't be understated, especially with the Affordable Care Act and the marketplaces that continue to reach new milestones with member enrollment growth up to 16 million signups for 2023. And so tapping into this growth will require payers to rethink the premium payments experience, which nearly half of payers said was a top challenge. And this challenge could certainly be addressed by understanding how members prefer to pay, as seen on the stats in this slide. Consumers, again, as I repeat myself, they want these digital automated payment experiences. And you think about the use case of a premium, which is a monthly bill, similar to the 91% of monthly bills that people are paying online for other things like utilities already, or of course, cell phones. Because when you look at the data, everyone pays their cell phone on time. It's the bill that's ranked the highest, and it's always automated and it's always digital payment methods. And so with that, you go to the next slide, and you see, that there's certainly competition that's coming into healthcare. And when you think about the global or even a national look at how do we tackle some of the challenges in healthcare, certainly, retail giants think about this, and they think about how do they enter the healthcare space. And they have the expertise in scaling operations and building consumer-centric experience. And there's certainly a threat out there that they win consumer and employer group business. And consumers increasingly flex their purchasing power in healthcare and are inclined to make decisions based on cost and convenience. Now, that doesn't mean that this is, the retailization of healthcare is moving rapidly, and that there still isn't so much to figure out, and there isn't so much that we should be all figuring out together, because just 1 in 10 consumers today say they've used a retail clinic in the past year. So if we go to this next slide, which is my final slide, I want to, end on a note of hope. And so when we look at the past decade of reporting on healthcare payments trends, we certainly see progress in key areas. Looking at some of the questions we ask providers, payers, and consumers year after year, we see that e-statement adoption is increasing. More providers are receiving payments from payers electronically, and it takes less time for providers to collect from patients. So while we still have lots of work to do in the healthcare payment space to truly drive digital experiences that benefit consumers, benefit providers, and benefit health plans, you can see that there is progress happening, and what we need to do collectively is figure out how to accelerate that progress. And now I'll pass it to the group to open it up for some questions.
Thanks, Deirdre. Just a reminder, taking a look at the next slide, if you do have questions, you can go ahead and answer them on the right-hand side of our screen. While we'll probably won't have time for everyone's question, you can always feel free to email us as well, core@caqh.org, and we can answer your questions there too. But while you all might be typing in a question or so for our speakers, we also did receive some registrant questions, and so I'm going to start with those. The first question is for Brad. How important are RTP and FedNow shaping up to be for health plans and payers?
I think that's still to be determined. I think that those are viable payments in the healthcare industry. I think when you look at the larger payments pie, figuratively speaking, there's room for another payment type, and those are viable payment types. I do think that you will have a similar issue with reassociation and reconciliation of the payment to the claim in the same way that you do with ACH today, but they're viable payment options.
Great, thanks, Brad.
Mhm.
All right, I just got a message from Erin. She's here. Her connection is a bit slow, so we might not see her on video.
Can you hear me?
Yes, oh, there you are. Perfect.
I'm not sure what happened.
No problem. All right, so this next question, Erin, you might be able to help answer. Have you seen any cases of identity theft involving use of a provider's NPI number to submit fraudulent billing? And is there a way for providers to confirm that nothing unusual is being billed out under their NPI?
That is a good question. Yeah, we have heard of those cases. We know that they're happening. And that's one of the reasons we are reconvening the core participants to review the EFT and ERA enrollment data operating rules. Are there requirements that we can add or consider for the enrollment process that will help prevent that kind of fraud and abuse and increase security? So if that is a challenge or something you're interested in, I would encourage you to reach out to us and share your thoughts so that we can make sure that we do the best we can with our rules to help prevent fraud and abuse.
Great. Thanks, Erin. All right. This next question, Brad, this one is for you as well. We currently use NACHA standards to send ACH payments for healthcare provider payments. However, for payment direction to our members' population, we currently send checks. Are there any innovations or trends on sending payments to enrolled members for claims?
I don't think there are any innovations necessarily, but those kind of payments would work just like direct deposit. I think the issue is getting the information from those members and getting their account number, routing number, which, I mean, you can collect that online and then you can affect the payment that way, but it's just an ACH credit like direct deposit. So there are some extra steps that you might need to take, but it would probably reduce costs in general because writing checks and that whole process itself is rather expensive.
Great, thanks, Brad. I think we have time for one more question before we wrap things up with our call to action. Are there any requirements for EFT enrollment to expire after a period of inactivity? And if there aren't, is this a best practice?
Was that for me?
Oh, sorry. You or everything.
Anyone?
That's a good question. It's something that I know CMS has heard as well, is that providers are being unenrolled in EFT and not notified of it, which can be a challenge. So again, this is an area that we may be able to influence or impact from an operating role perspective and invite folks to bring their ideas to the table as we go through that process.
And I'll add to that. I think it depends on the level or the time frame of inactivity. If it's 6 months, no, but if it's been a couple of years, you probably want to reconfirm the information and if that account is still good or not. Just one of those technical things.
Great, thank you all. If you take a look at the next slide quickly, I just want to wrap things up with a brief call to action and guide you to some of our resources. So if you do download those handouts or take a look at your email in the next day, you'll get a link to where to find how to download the slides, and you can use the links here. NACHA provided us with a healthcare EFT resource link, and InstaMed has their link to the trends report that Deirdre presented on today. Similarly, Erin mentioned, if you want to get involved in operating rule development, please feel free to email us, core@caqh.org, to join as a participating organization. And then lastly, CAQH is having a conference, and that is September 27th to 29th. It's called CAQH Connect, where we're bringing together healthcare industry experts, leaders from health plans, industry associations, all of our stakeholders in Washington, D.C. So there is also a link to register there, and we hope to see you joining us at that time. Otherwise, I think we're right at time, so it's 3 o'clock. Thank you all so much for joining us, and thank you, Brad and Deirdre, for speaking with us today. It was a great presentation.
Sure.
Yeah, thank you all so much.